welcome back to my channel. Today I'm speaking on a medical topic that affects a small amount of people. I want to speak on a medical condition that there is not a cure for thus far, and it has pretty much affected me for some time. So just to give a little background, I want to say it was in 2011. I started realizing that sometimes when I eat, like, food got stuck in my throat. It's no way to put it. It would just go down slow, or it would stay in one spot for a while. I could still breathe, but it kind of was like somebody was choking me. It's kind of hard to describe, but I just kind of feel that after 20 something years, I don't think I forgot how to eat. What it felt like was, I would have something to eat, and sometimes it would go down fine. Other times it would go down and it would go down, stop, go down, stop, go down, stop. Very uncomfortable feeling, something that's very painful to experience. And also, it kind of makes you panic, it makes you panic. Imagine you're out with friends and everyone's enjoying themselves, and then you have an episode, you can't breathe, and everybody's asking you, what's wrong? And it kind of makes you freak out even more. One particular situation that really impacted me, that motivated me to do what I had to do, just to take care of myself. And I think that's the most important thing. If anyone else is going through any of the symptoms that I mentioned, the most important thing is to take care of yourself, and don't be afraid to do so. So I had a situation. I think it was caused, I want to say, I was in it was basically a distressing situation. So my grandmother had just passed away. Anyone who knows me know that she was like a mother to me. Obviously my mom is there, but she had a great impact in my life, and she had just passed away. And my grandfather pretty much gave me the car to use, and as soon as I got the car, other people had drove it, and then I got the car, and it didn't have any gas. Just being a younger person at the time, it wasn't really second nature to keep checking the not speedometer, but keep checking the gas to make sure there was gas in there. Anyways, I pretty much ran out of gas. But not only that, the car had I'm not a mechanic, obviously, but the car had a situation where if you keep running it on low gas, it can mess something up mechanically. And I'm stranded. I'm out and about. I'm stranded. I am going through something mentally and emotionally, because I'm like, oh man, And so I had bought Coney Island. And, a lot of people, when they get, flustered, like, oh, I'm just going to eat. Well, I had my Coney Island. I was like, let me just take another bite of my food. I took another bite of my food, and it got stuck in my esophagus. And literally what I was doing before that helped. I would chew really, really slow. But obviously when you're in a nervous state, you may not chew slow. I mean, you're not paying attention. And so I usually drink water with all my meals. And anyways, I had an episode, and someone I knew saw me on the side of the road, and they came to help. And I just remember just walking down the road, because I'm trying to get myself together if I have that awkward situation where, what's wrong? Oh my God, Key, what's wrong? And that just makes me panic even more. So I decided to drink water. I went to drink water. The water got trapped on top of the food. It was the worst experience probably of my life. Obviously I got some time to go, but that really impacted me, because I'm literally walking down the street, and the person person that was with me kept asking what my mother's number was, and I'm like, I don't know, I'm not gonna make it if I don't fix the situation, because it got to the point where my muscles tightened up and I started to like choke and feel lightheaded, and my muscles, it was the weirdest thing. I did not move the food down, and I know for a fact that I had, not 5, I chewed so that it can digest. And so I got to the point where I literally was sitting on the concrete, and I started praying, God, please don't let me die like this, please don't let me die like this. And I can't explain it to this day, but my muscles just released, and all this water shot through my nose, and I said, I have to do something about this, because it can affect the quality of my life, the longevity of my life. And so I started doing research. Now, obviously, the first thing we do is we go to Google our symptoms. And in my mind, I had self-diagnosed myself with throat cancer. It was a few things. They had the regular acid reflux and whatever. And so I'm like, listen, if I have throat cancer, I'm gonna spearhead it. I know that my Creator has my back. Whatever happens, come what may, whatever they tell me, I am going to deal with. And pretty much, that's the mindset I had. I didn't know. So I looked up different tests that they would conduct. One of them was an endoscopy. And I literally had to slap, kind of get yourself together, kind of slap myself, because the test involves, I don't know if you guys ever had one, but with the way that they describe it, if you never had one and then you read how they do it, they stick a long tube, it's a camera actually, they go down your esophagus, and they can go all the way down to the stomach, and some people can go, I think some people have tests where it goes all the way further into the intestines or something. It can it's like a long tube, and they have to put you under. The idea of a tube being, jammed inside, it freaked me out, but I just had to literally just get my mind together and everything to go. And I did have a lot of support, but they do put you under. And pretty much, when I came to, the doctor gave me the news that I have EOE, which it stands for eosinophilic esophagitis. So, after he told me this, pretty much, if you guys were to basically Google what this is, EOE is a chronic allergic inflammatory disease of the esophagus, the tube connecting the mouth to the stomach. It occurs when a type of white blood cell, the eosinophil, accumulates in the esophagus. So just to get into some of the symptoms, because I also Googled the symptoms, just so that you guys can understand, because not everyone who has this illness have the same symptoms. Like for me, my symptoms are violent vomiting. It is food getting stuck in my throat, nauseated, fatigue. Those are just some of the symptoms that I deal with. And some of the people who get this, a lot of people who get this particular autoimmune system disease have a hard time functioning, have a hard time working. If it gets bad enough, it can get to the point where they have a tube inserted just to eat their meals. So it's very dire. The atmosphere can affect it, meaning pretty much if you're allergic to pollen, or if you're allergic to dust, or whatever the case, you could just have a reaction. Some people just have allergy. It's allergy season. Well, for a person who has EOE, that's a terrible place to be, because you're affected by breathing, you're affected by eating. It's difficult. And I kind of felt alone in this situation, because they mentioned that it is a newer disease, a newly recognized disease, that it's rare, but over the past few years, there have been more and more people being diagnosed with it. So just to kind of get into some of the symptoms that I Googled: difficulty swallowing, food getting stuck in the esophagus, chest pain that is often centrally located and does not respond to antacids or Tums or Pepto-Bismol, not Pepto, is that an anti? Well, whatever, you know, the Tums, the antacid. Persistent heartburn, abdominal pain. One website that I was able to bring up mentions that in children and infants, they have vomiting, which I'm not a child, but I have that problem bad. Like, I'll sit there and I just can't keep it down. Malnutrition is another one. So the website mentioned failure to thrive as a child, as an adult. If you can't keep your food down, how can you keep the nutrients down? So for me personally, I have been taking multivitamins and just trying to watch my diet. Now, going back to the day that I was at the hospital, they said, okay, I'll just say Key. Key, we're going to have you come back in because you're still having a problem with swallowing. Now we know what the problem is. Now we can see about how to fix it. So they said, we're going to have to conduct a balloon test. And there's maybe a more technical term for it, but basically they have to go in again, and it takes something it's like they blow air into it. It blows up like a balloon. It stretches the esophagus. So I had to have that happen. Now, when I was younger, let's go back to being a toddler. Just remembering back when I was a toddler, I used to get lumps in my throat. And it would last for a long time. Like, I would have that feeling of food being in there, but I don't know how to describe it. Not to say normal people, but regular people who don't have this issue have had lumps in their throat. So it's kind of hard to say, that's, you have a lump in your throat, you have to be careful. It's kind of hard to pinpoint that, and then as time went on, I had issues with eating. The food wouldn't go down. I didn't have vomiting issues at this time. So after I received the balloon test that they said could last a few days, a few weeks, or up to 7 years, but pretty much I would have to keep getting it done because eventually that if I don't rectify the situation, my throat's gonna close again. Then comes the vomiting problem. And so it's very uncomfortable. So to my diet, pretty much the doctors instructed me to go on the elimination diet, and that's all they said. My doctor, and I went to a GI doctor, but it's allergy related. So I'm trying to put 2 and 2 together because he said, oh, just do blah, blah, blah. Well, I can go on an elimination diet, but so now I'm trying to figure out how to properly do the elimination diet. Well, if it's an allergy disease, then it makes more sense to see what I'm allergic to. Well, I know there's a few things that I'm allergic to already, but let me go to an immunologist. Hopefully I'm pronouncing that correctly. It's basically an allergy doctor. They did the test where they poke you with a few different needles, and whatever you have a reaction to, that's what you're allergic to. So that's that. But then I also had, I can't think of the test. I also had an ultrasound. They did an ultrasound. So I went to another doctor after I went to the allergy doctor, and then they did an ultrasound because I'm still having these issues. I'm still fighting it. I'm still trying to watch my diet, but how do you watch your diet if they're like, well, it's not much you're allergic to? So I went to another doctor and I had blood work done, and they're like, you have a high level of something. It was something that they said in my records that I had a high level of intolerance towards wheat. So So I started looking up things about that and kind of going gluten-free. But this whole process has been pretty much, it's kind of like trial and error. So anyone who's going through this issue, don't give up. I know that everyone suffers differently. Everyone has different symptoms. A lot of people cannot hold down a job with this type of illness because you could be fine and then you have lunch and it's over. Don't give up in your search. For me, I looked everywhere. I tried to read a lot of articles, look things up online. My family has even gotten involved. My friends have even gotten involved. And I think that's important for anyone who's watching this as well. If you have a friend that struggles with this, it helps for you to be supportive because it's emotionally, mentally, and physically straining. A person could look healthy, but it's hard. It's hard for me to go to a regular restaurant without saying, is it gluten-free? And even if it is gluten-free, was the counters contaminated? I mean, it just, I don't know, it's a difficult thing. And you have some people who they start bringing their own meals to a restaurant. I'm like, God, it's, I'm not used to that, but if I have to, I will. Or I would probably just get something to drink or maybe a dessert. But desserts are a little iffy because of the gluten factor. But, and I know I'm kind of going around in a circle, but if you're a family, you're a friend, it helps to be supportive. My friends, my family, my husband, they are all very supportive, and I feel bad because majority of my friends are fairly healthy, and they have to cater dinners over their house around my issues, but it helps, it really helps when you're supportive. So as far as what I'm taking for it right now, first and foremost, I was prescribed with inhalers you can swallow, probiotics, some other things. Right now I'm taking probiotics. I do want to kind of cut back on those eosinophils, which I'm looking at things that could reduce inflammation like turmeric. I'm trying to really go the natural route, not just kind of hide the problem. I do want to reduce the eosinophils, the white blood cells in my esophagus. That's what I'm trying to do. So there are a few natural ways to do so. I'm not a physician. You could choose to take the medications if you like. Just look at the symptoms, look at the side effects, and then make your decision accordingly. Everybody has to make their own decision, but that's kind of what I'm doing, as well as still focused on my diet. I will do the elimination diet, but I'm also trying to just pinpoint what's making me sick and keep a journal of that and things like that. But it's good to be prepared. Now I will forewarn you guys, I had a few technical issues. So just to kind of reiterate, I did this video already. It somehow got deleted, and now I'm doing it today. Had technical issues, so there may be a few differences here or there in adjustments with the camera. But so I just wanted to kind of backtrack. So a few other symptoms, if you're having these symptoms, is something to take note of, and then pretty much I'll conclude on this note. So a few symptoms were like for me, I eat, get extremely tired, like where I can't function or do anything. I don't have any energy, and then I fall asleep. Now sometimes there can be some type of buildup in the throat. It could be acid along with whatever. It's buildup in the throat, and it has caused me to wake up out of my sleep gasping for air. Now I have been over like friends' house and things of that sort. Don't know if you have that issue or have had that issue, but that's something that I've had to deal with. As well as when I went to the allergy doctor, I took a breathing test and failed it several times. My thought process is maybe because of the constriction of my throat. My breathing isn't normal. I haven't been breathing normal for a while. Didn't realize it until they prescribed me with an inhaler. So some people have been prescribed an inhaler through the process as well. So those are just a few other symptoms to look out for. I know I kind of jumped around a little bit, but I had some important information I want to share with you. So with that being said, I am going to conclude this video. I do appreciate you watching. I will tell you, if you struggle with this, you're not alone. It may feel like it, but you're not alone. There is people that have traditionally normal lives. I guess no one really has it. Listen, we're going through the quarantine. You know, a lot has happened this year in general, so I don't know how normal life can be, but there are people who live average lives who have this situation. You're not by yourself that have these issues. I want to encourage you to keep strong through it all. You got it. Just keep on fighting through it. Blood, sweat, and tears. We have to find a solution to the issues that make life a little bit difficult, very difficult if you can't breathe or eat, things of that sort. But you're not by yourself. So I will tell you, if you've come, even if you're just passing through, if you have a word of advice, please leave a comment. If you have any suggestions or if you have any questions, please put that there. And, you know, I'm inviting you to stay. I'm inviting you to subscribe to my channel. I do have a lot of content, you know, because I want to talk about any and everything, you know, that's important to me, or if I feel like it's an important topic, or if I just feel like doing it, I will. But stay. My videos are typically not this long-winded, but I thought it was an important topic to go over, something that affects me, something that affects other people. So with that being said, I will catch you on the next one.